At the Edmonton West Primary Care Network, we know that the best primary care is provided to patients through team-based care, which is a fundamental pillar of the patient's medical home.
On behalf of the Board of Directors of the Edmonton West Primary Care Network, I would like to welcome you to the 2019 Report to the Community.
Patients are at the center of our care as we strive to keep them healthy through every stage of life. Our family physicians work together with a team of professionals to offer a variety of primary health services, education, and supports to enhance their overall well-being.
I'd like to thank the YMCA and the City of Edmonton, our joint venture partners at Alberta Health and Alberta Health Services, the Faculty of Medicine's residency program at the University of Alberta, the other Edmonton Zone PCNs, and our community pharmacies and DynaLife who've allowed us to offer progressive treatment for addictions.
Only by collaborating together and building stronger partnerships can we truly provide the best primary care to our community.
I think the most rewarding aspect about providing team-based care is the perspective that the allied health professionals bring. Not only does it enhance the care of the patients, but it also makes our jobs easier.
It really focuses on patient-centered care and understanding the patient's needs and collaborating and deciding which direction we need to go. So it really depends on the patient, and having that support makes a huge difference.
We are good stewards of our resources. 182 physicians provide care and support to more than 182,000 patients. The Edmonton West Primary Care Network is proud to have some of the highest screening rates in Edmonton, with 81% of our patients accessing prevention and early detection information they need to manage their health and wellness. And we know people are healthier and live longer when they have a family physician and medical home. It's why it is so important that we are supporting Alberta Health's goal of helping patients find a family physician for their primary care needs. 13 of 16 studies showed positive results in improved health. 11 of 11 studies showed reduced mortality. We are pleased to highlight some of our collaborative partnerships, including the Low Risk Maternity Clinic, Alberta Health Services Opioid Dependency Program, and our interdisciplinary team-based care. The partnerships are endless at the Edmonton West Primary Care Network's Low Risk Maternity Clinic. In 2018-2019, the Low Risk Maternity Clinic cared for 334 women and their families with prenatal, delivery, and postnatal care. It's an opportunity to provide a complete primary care solution, whether it's through a referral from a family physician or a self-referral. In fact, many of the mothers who self-refer to the clinic are newcomers to Edmonton who have not yet attached to a medical home. The EWPCN can connect these patients to a family physician for ongoing primary care for the whole family.
All of the doctors that work here are family physicians, and as such I think we have a little bit of a more holistic approach, looking at the whole patient as a person and also the family as well.
Patients may have originally come to the Low Risk Maternity Clinic for prenatal care, but then, after the baby arrives, they need to find a family doctor or perhaps need counseling or another primary care provider. These arrangements can be made very quickly.
It's just great knowing that there's an incredibly knowledgeable team here at the Primary Care Network that will work with me throughout my pregnancy and after.
Another important relationship with the Low Risk Maternity Clinic is the cooperative learning and professional development that goes through the University of Alberta's Faculty of Medicine to provide maternity experience for residents.
The partnership with the Edmonton West PCN has been a great support for my residency, particularly with maternity care. We get the opportunity to do maternity care with low-risk obstetrics here once a week. This is my first year being involved with any form of primary care network. I have sent a lot of patients to different services, especially behavioral counseling, with smoking cessation counseling, liaising them with social workers, so I've heavily relied on them.
It is this holistic approach to caring for all the healthcare needs of our patients and their family that makes the EWPCN so remarkable.
I really enjoy the team of experts here. I was emotionally going through a lot too. I had gone through a lot of traumatic things throughout my pregnancy. They allowed me to actually meet up with other people for counseling, so it's really handy.
One of the newest innovative partnerships within the Edmonton West Primary Care Network is with the delivery of the Alberta Health Services Opioid Dependency Program in our main office at the Meadowlark Health and Shopping Centre. The EWPCN was selected as the first primary care network in the province to partner with Alberta Health Services to provide opioid agonist therapy. The Opioid Dependency Clinic satellite location opened in August 2018. By extending access to care in the community, we are pleased to be a part of the solution to the opioid crisis in Alberta. And it is making a real impact in the lives of our patients.
My primary care team has played quite a few roles in my recovery, especially offering me options for different medications that I can try, offering support, and helping me through really difficult experiences.
The Edmonton West PCN has really helped my patients access the services, primarily through the ease of access, the free parking, the accessibility to the lab and the pharmacy just down the hall has all really contributed to their success. When patients call the number, they will be initiated on opioid agonist therapy. The current model is that the patients would be started on methadone or Suboxone. We definitely notify any physician that's been involved in the patient's care so that they know they're part of the program. To increase the comfort of the family physicians in prescribing Suboxone so that they feel comfortable when the patient transitions back into their own medical home.
I didn't imagine that my opportunities around these programs were possible or that these options even existed. And now that they're going to be available in the communities is such a relief. I have a chance to be with my family and feel stable in my life and secure and safe.
Every day, our interdisciplinary team works together to meet the needs of our patients. Here is just one of the thousands of examples of how our productive interdisciplinary partnerships work in team-based care within a patient's medical home.
Darlene's been incredible. She shows up regularly, she puts in the effort.
When Darlene first went to see her family doctor about pain and discoloration in her feet, she was walking with a cane.
It was discovered I had peripheral artery disease. So then I went to the lower leg clinic at the West End Primary Care Network.
Once treated and stabilized at the lower leg clinic, our registered nurse knew that a supervised exercise program is considered part of best practice treatment of peripheral arterial disease, as it helps to develop collateral vessels, decrease pain, and increase her ability to walk.
With peripheral artery disease, we just need regular circulation to the legs. I can't believe her progress. It's been seamless and easy for her to get much healthier and have a good quality of life.
Darlene's success and continued motivation to keep active is sustained with the affiliation with the Jamie Platts YMCA.
Community partnerships are so important and valuable. They get an opportunity to exercise in a facility that has all the equipment they need. They get to be integrated into the West End community. They get to meet new people, and then they can go out into the community and tell about all the wonderful things that the Jamie Platts has to offer.
It motivates me to keep coming back because I don't want to go backwards, I want to go forward.
At the Edmonton West Primary Care Network, we have endless opportunities to work in partnership and provide team-based care, which make a real difference in the lives of our patients. Whether it is welcoming new life into the world, providing support for a successful recovery from an addiction, or helping a patient walk without a cane, we are with our patients every step of the way. By working in collaborative partnerships, we can continue to provide the best primary care to the community. We can make what seems impossible possible.